Welcome to another exciting podcast with me. It's your host, Vance. I'm back every week. We have a different speaker. And of course, we're always diving into different topics to understand about health. And of course, today's our guest speaker is Dr. Dinesh Nair, cardiologist from Heart Matters Medical Center Private Limited. Today, we're going to talk about how to prevent and detect heart disease. And Dr. Dinesh has been our guest speaker. I think this will be our third time. I know he's having despite he's having a very tight schedule, but he still, give us that 1 hour to be with Kopi events, to share his knowledge, his expertise. But, there are a few things that you should be asking Dr. Dinesh, but there are a few things that you should never ask cardiologists. Do you have a heart? That's not pretty good question to ask, right? All of us have a heart. And on a serious note, heart conditions in Singapore, heart diseases seems to be always in a steady growth, despite our Ministry of Health is talking about healthy exercises, health promotion board is talking about, keeping heart and keeping all the cholesterol low by eating healthier and sugary drinks. Even our Minister of Health, Hong Eng Khan, also have said that, health is most priority that we should be taking. Without any further ado, I'm going to invite Dr. Dinesh and we're going to start our podcast. Let's invite Dr. Dinesh Nair. Hello, doctor.
Hi, Vance. How are you doing, my friend?
I am good, sir. How are you, sir?
Very good, very good. Good to be on your show again. Thanks for having us.
Thank you, Dr. Dinesh.
This is the third time we've been on now. We've been trying to count, so it's...
That's right, third time. And thank you so much. I know you had a very busy schedule, but despite that, you still give us 1 hour of your precious time and to highlight what is it all about in preventing and detect heart diseases. Thank you so much, Dr. Dinesh Nair.
No, always happy to share information about heart health and general health as well. I'm a cardiologist, as you know, so our primary objective is to reduce the burden of heart disease, especially in the population, in society, around the world, if you will. So we've got some new stuff that we haven't gone through on previous shows, so we'll go through that later on as well. But I'm happy to be here, so fire away, ask me what you will, and I'll see if I can help you out.
Thank you, doctor. Thank you so much. And of course, today's our topic is about how to prevent and detect heart diseases. So viewers are watching this. Please do share and like so that more of your friends, families, and you can reach out to many people out there who are having social media to get connected and get this piece of information. In fact, not even a piece of lengthy of 1 hour of podcast with Dr. Dinesh Nair itself. Thank you, doctor. I'm going to jump in straight into the topic. Of course, in the past 2 podcasts that you with us, we talked a lot about our heart. We understand about it. We talked about the growth in this area of heart diseases and how to prevent and how to detect. But still, the heart disease is still very important to talk about it. And doc, I give you a very honest think about it, right? People only see a doctor when there's an issue, but like a regular checkup is so important, especially the heart, right? Once the heart decide to give you a give up sign, that's it. So can we talk about this and why people are afraid to see doctors, busy because they tell you you got something and then they get worried? Is it better to get prevention rather than, going through it?
Yeah. So, I mean, we're all human beings, and we have a little voice in our head that tells us you need to go and check, um, find out what's going on. But there's another little voice like, no, I don't really want to find out. And one of the many reasons why people actually don't go and do these tests, don't go and do checkups, is they're afraid of finding out that they have a problem, afraid of finding out that the problem may be big. But what many don't realize is that we live in a fantastic age now, a modern age, where there's such good and new technology. Every week, there's new stuff being found out. Most things regarding the heart, anyway, that we find out with these tests can be resolved. There's almost always some sort of a solution. It may not be a permanent solution. You can't cure heart disease, but you can treat it, and you can treat it very well. It is very rarely terminal unless you've had a heart attack. And that's another reason why you should check up front, because you want to prevent a heart attack before it happens. You want to prevent a cardiac arrest. That is when the heart stops beating before it happens. 80% of cardiac arrests come from heart attacks or big blocks in the heart arteries. So what you need to do is try to prevent things like this happening. Now, I saw that question that you popped up earlier saying, what is heart disease? Now, heart disease is not just about having blocks in the heart arteries.
Yeah.
Blocks in the heart arteries are just one aspect of it. Heart disease is, as the two words describe, disease of the heart. What does your heart do? Your heart pumps blood out to the rest of the body. Make sure there's enough oxygen going up towards your brain. Make sure there's enough oxygen going to all the limbs and to it as well. So it has all these arteries coming out from it that branch and go through the whole body. Some of it goes to the heart itself. So because the heart is a muscle that's beating all the time, it needs its own oxygen supply. So if the heart cannot provide that oxygen supply to itself or to the rest of the body, whichever area it cannot supply is going to have a compromise. So let's say it's the brain. No blood flow to the brain because the heart can't pump it up to the brain. The heart stops.
Right.
You get a brain attack or stroke. If you have a block in the arteries from the heart going up towards the brain, and it's very, very tight, or if it's almost closed off or closes off, once again, you get a brain attack. If you have lack of blood supply to the heart muscle, you get a heart attack if it's for a prolonged period of time. But what you can get is a reduction of flow to the heart muscle, and that can make the heart weaken. Now, that is just one aspect of it, of course. You can have disorders of the heart where the heart muscle has a problem of its own. It can be congenital. It can be acquired. COVID can attack the heart muscle. Viral illnesses can attack the heart muscle. That is a type of heart disease. There's a word for it, or several words for it: myocarditis, cardiomyopathy, pericarditis. You may have heard all these words thrown out during the period, and they all mean slightly different things. But what it means is that the virus may have attacked the heart muscle.
Right.
Okay, one type of heart disease. You may be born with abnormalities of the heart. You may have holes in the heart. You may have valves that when you were born were incompetent to start with and became worse over time. It may manifest with a very bad disease when the baby is born, but it may also be something that progresses over time. And you can have this progression over time from a baby till 3 years old, 4 years old, 10 years old. And sometimes the first time people find out they've had a hole in the heart, and I'll explain what a hole in the heart is in a short while, is when they're like 50, 60 years of age and the heart can't pump so much. So when we go to this hole in the heart issue, basically, if you remember, many people might remember from school, there are 4 chambers in the heart, okay? Top chambers, bottom chambers. The heart pumps blood out from one main chamber called the left ventricle out to the rest of the body, which I was describing, and to all these organs that it supplies the blood to. That blood carries oxygen that nourishes all these different organs, all these different areas, okay? So now, if you had a hole in the heart, it is because when the baby is in the mother's womb, you get your blood supply, your oxygen from the mother while you're in the womb. As soon as baby is born, these holes start to close off, usually within days, sometimes within months, and usually within the first 3 years of life. But for some people, the holes in the heart remain. And what you get is blood, instead of flowing the correct way, they flow in a wrong direction. And over time, the heart is trying to work harder to pump forward, and it struggles. So holes in the heart can manifest later in life. That is one type of heart disease. The other one is that you're born with valves that are incompetent. Some people are born without a certain artery going into a certain place. These are all called congenital heart problems. So we talked about the most common blocks in the heart arteries, heart muscle problems, congenital issues, valve issues of the heart, diseases that are manifested in the heart from viral illnesses. And it has become more evident in recent times with COVID. That is a wide spectrum of what heart disease is. But once again, the most common cause of heart problems is going to be blocks in the heart arteries. And these blocks occur because cholesterol plaques or cholesterol deposits are built inside the arteries over time, reducing the blood flow. And this happens as we age. This happens because our cholesterol is high. This happens because we don't manage our lifestyle well. This happens because we've got, things you're born with, like high blood pressure, diabetes. High blood pressure and diabetes, you need to generally have a genetic predisposition to having them. So that is why heart disease is actually a spectrum of things. And why is it important to talk about it? It is the number one killer. Cardiovascular disease, heart and vessel disease, heart attacks, heart-related deaths, stroke, etc. Cardiovascular disease is number one, along and up there with cancer. Because, you think about cancer. Cancer can be cancer of the brain. Cancer can be cancer of the legs, even cancer of the lungs, anywhere. But you've got cancer and you've got cardiovascular disease, the two big killers. This cardiovascular disease can be detected early. A lot of cancer is related to luck. Some of the cardiovascular disease is genetic and therefore related to luck. If you're unfortunate and you're born with very high cholesterol from an early age, you need treatment early. We have teenagers who are given tablets or medication from an early age because they're detected early. And that is why we need to detect all these things early enough. It is important to talk about it because when people are aware, that's when they can go and proactively check for these things.
Wow.
I don't know if that makes sense, but
it's very intense, but Dr. Bhatti, thanks for explaining all that. But to make it even more simpler, in the past, right, people who are obese, you're carrying extra 40, 50 kg, you got to lose weight, you got to be very careful. But nowadays, like what you have mentioned, there are someone can be even fit, going for a walk or some kind of exercises if they never check their medical checkup for a period of time. I think that could be very dangerous, right? I mean, like what you said, it can be like genetics or something that they have not checked, like you just mentioned, like the hole in the heart until the age of 50 or 60, then they discover, and then the heart goes under a humongous amount of stress. So that's a bit of a bit scary, right, doc?
It is scary, and that's why people don't want to check it because they're afraid to find out, of course. But once again, we live in a fantastic age where there's so many advancements in medical technology. We can fix these things if they're found early enough. And that's why prevention is better than cure. Early detection is the most important thing as we move forward. And it's very interesting. You mentioned, fit people. I've got people walking into my clinic, washboard abdominals. You can see the veins running on their abs, super fit, running marathons and all that kind of stuff. But they've got blocks as well. They've got blocks because their cholesterol's high. They've never checked it because they thought they were very fit and healthy. On the other hand, of course, you have these healthy people running marathons. They've never done a very detailed check. They're born with the heart arteries running the wrong way, congenital. And the first time it manifests is when they have a cardiac arrest. So it is true. It is scary. But the advantage is if you check very early, you can prevent. And that's why a lot of sports programs in schools are very different from, let's say, your time and my time many years ago. Nowadays, you get ECGs before people go in and do sports, ECGs and checks before they go into the army. So a lot of people are screened early enough. The government has got many different programs being run out to check your sugar, check your blood pressure early enough. These are ways to prevent these problems and to detect disease early. So it is not that scary in that there are ways to manage it, as long as we are proactive in trying to manage this and find out about it early on as well.
Doctor, it's something like that, right? If I'm not hearing anything, I'm not worried. But that I think, like what you said, in the modern age we are right now, with so much of medical science is always evolving and new things are coming to detect and prevent a lot of stuff. Doctor, before we go into the next segment, when it comes to a heart attack, myocardial infarction, is there a percentage? Will you say that if somebody got a myocardial infarction, they can be recovered, or what is the fatal rate in these cases that you've seen before?
So it is a very interesting question you asked, because the fatality and the chances of surviving a myocardial infarction or heart attack depend on the support and surrounding system that you have. And to a large degree, it depends on which country you live in. If you live in a big country where you're very far from any medical support, you have a problem. We are very lucky in Singapore. We live in a small country. Wherever you are on the island, there's a system in place. If someone's having a heart attack, as long as it's detected and someone calls up, an ambulance comes, brings that patient or that person to the nearest hospital, and within 60 minutes to 90 minutes, and that is our cutoff time, the artery is opened up after a heart attack. So if you're having a heart attack, probably the best place to live in the world is to be in Singapore. I'm telling you. Because we're small, we have the facilities, we have a system in place for it. So what are the chances of surviving it? Very high when you're in Singapore. If you survive the first few minutes after a heart attack without a cardiac arrest. Now, I mentioned cardiac arrest where the heart stops because you go into an abnormal rhythm. Once you survive those first few minutes, your chances of surviving a heart attack in Singapore are very good, generally. But if someone has collapsed immediately and needs CPR, then those chances are lower, of course.
Doctor, I mean, as we talk about this, I think you made a very solid point. Best place to say in Singapore is Singapore, right? Every estate, every block, there's an AED our government has put in place, and now a fire extinguisher as well. The other day I was like, hey, how come there's a fire extinguisher under my block? I've never seen before. So there's an AED, there's a fire extinguisher just in front of the lift. And I think in our local government also, they are pushing everybody to to be certified and to get, like what you mentioned, right? The help is within there. So I think it's a brilliant point that you bring in, Dr. Dinesh, about getting help in the right time.
No, entirely. I remember. I mean, I'm a bit older. Okay, I remember Singapore in the 70s, the 80s, 90s. Okay,
Yeah.
and around 1990, 2000, we had a big change in pushing towards. We were just trying to develop as a nation in pushing towards getting all these systems in place. 15 years ago, 20 years ago, we didn't have all these AEDs in the void decks. We didn't have them in office buildings. Now they're everywhere. Okay, and people are taught how to use it. With it, the technology has moved on because we didn't have AEDs forever. There was a time when these AEDs didn't exist. All you had was those big defibrillator type thingies brought in by the ambulance, and not all ambulances had them as well. So technology has moved on. The willingness of the country to be healthy has moved on. The population has become more aware, and all these things have played a part as well. So that's why we are living in a fantastic age where your chances of surviving are actually very good.
Thank you, Doctor. And at this point of time, I want to give my greatest appreciation to Singapore Civil Defence Force, SCDF, because I'm on this AED on Wheels program, which means they have given me an AED that I keep in my car. And every 8 months or so, I just have to go and make sure that the AED is working. So, and of course, you're going to be AED certified.
Fantastic.
So, I mean, like I said, Doc, I'm not sure because for the past 20 years, I've been certified in CPR AED, but will I be able to perform when the actual scenario comes in? I'm not sure, but hopefully I'll be able to, right? Doctor, we're going to go into the next one, which is, the everyday habits. I know you talked about, very holistic, make sure that you check whether your HbA1c is high or whether your cholesterol is, in the border, to make sure that everyone is healthy in terms of doing regular checkups. But well, there's something that you want to talk about, Doc, like everyday habits that can help prevent heart disease. I mean, we are in Singapore, so we love our Chinese, Indian, Malay, all kind of cruising foods. So very tough. So yours, Doc.
I mean, I think in general, you don't want to torture yourself. You don't want to live a Spartan lifestyle where every day is horrible because all you eat is boiled soup and vegetables and nothing else. I mean, that's rough. Okay, so we need to have some variety in our life. But I think the main principle to take heed of is everything in moderation. And if we live by those principles, it is very simple. Don't overdo anything. Nobody says don't go and have a drink or alcohol. Okay, if it's in your lifestyle, it's what you do. Okay, have a few drinks, but don't go and overdo it. Same way, if you've got a lot of fatty food and you like fatty food, okay, taste it once in a while, it's okay, but throw away the unhealthy bits. I mean, it's a horrible rule, but if it tastes really, really good, the likelihood is it's not going to be that good for you, right? But that doesn't mean you can't eat the really, really good stuff, a really, really good tasting stuff. But just do it in moderation. Try and make sure that your meals are balanced. First of all, there's enough protein, carbohydrate, very little fat if possible. Usually have a balanced diet. A good rule of thumb, okay, for a plate, of course, is, if you're a meat eater, and there are, of course, some vegetarians as well, and I'm sure out there in the audience, and they have their own way of getting protein, not larger than the size of your fist. And, some people have bigger fists than others, so they're luckier perhaps, but not larger than the size of your fist in meat. And if you're really trying to lose weight, maybe not larger than the size of your palm, okay, in meat. Vegetables, make sure it's at least the size of your fist. And if you take carbohydrates and rice, reduce that amount to the size of your fist. Now, if you have a few meals a day like that, you're fine. Now, if you are a fitness buff or a bodybuilder or somebody who trains a whole load and is building muscle, of course, you need much more protein than this. So, of course, this is a general rule, but it depends on how you live your life. And if there are people who are bodybuilders, fitness guys like yourself who've got a whole load of muscle, okay, you need much more protein to maintain that. And that is okay. It doesn't mean that protein is bad. But what you need to do is try and keep your body fat percentage down. And I mean, there's no test that is better than something called the mirror test. When you look at yourself in the mirror, you kind of know. Okay. So what are some everyday habits? Be healthy, try and exercise as much as you can. Try and get as much sleep as you can as well, because sleep is when your body recovers. Sleep is when your body heals itself, from the rigors of a hard day, from your rigorous exercise regime as well. 30 minutes, 3 to 4 times a week is what people advise. Sometimes it's very difficult to do, but there are ways you can do more productive exercises, 15 to 20 minutes, 3 to 4 times a day. Drop them in between your busy schedule, you can manage. Of course, if you are someone like yourself, a gym buff, you go in, you do more than an hour or two here and there, fair enough. Okay, but make sure there's enough time to recover. Make sure you got enough time to sleep. Make sure you eat a healthy diet. And try to reduce stress in life. That's very easy to say, not so easy to do, right? And a lot of that is in our minds as well. Whether we ruminate, we think on things too much. And they're very simple things. It's all stuff that we know. And that's why I say the simple caveat is everything in moderation.
Beautiful, Doc. I mean, these are golden words. These are golden advices. People have to listen and then, just to refocus back and say, okay, this is what I need to do. These are simple reminders. And coming out from a heart expert like yourself, Doc, I mean, as a cardiologist, you know exactly what happened inside. A lot of us, we just know we are living in this body, but we don't really understand about how our organ works, and sometimes we just abuse ourselves. But Doc, that's very interesting that you talked about alcohol, have moderation kind of stuff. But I mean, this is what I heard most of the time. Doctors love drinking wine. I mean,
which doctors are you referring to? I'm kidding.
I heard some doctors having wine collections, huge wine cellars, and all this kind of stuff. What is it that the wine and doctors always the relationship with?
I don't know. So first of all, I don't have a huge wine collection. I don't have a wine cellar. I do drink a bit of wine. I do drink a bit of this, that, and the other from time to time, but we just make sure you don't overdo it. Don't drink too much.
Yeah.
There has been a lot of talk about how, there's different types of alcohol and which alcohols are healthier compared to the other. And wine has got certain stuff in it, like tannins and a few other interesting ingredients, especially red wine, which make it healthier than, let's say, white wine, and healthier definitely than beer or hard liquor. And once again, it's okay to drink a few glasses of wine here and there, but not to be drinking 2 or 3 bottles a day. So it doesn't make sense to do that. And once again, we go back to the original principle of everything in moderation. And why do some of these doctors have huge wine collections? Because actually, you can actually invest in wine, and some of them actually do, and their bottles aged. It makes money over time.
True.
I'm not smart enough to have a wine collection, so I actually don't have one.
You know why, Doc? Because I asked you, I mean, on a side note of that, I have a particular good friend. He said, Vance, I'm just collecting wines. If it doesn't sell, you know what? Come over, bring along friends, and we have a couple of wines. I say, how many glasses of wine do you drink? Oh, I just drink 2 glasses every day. I said, I mean, you're drinking a couple of bottles a week. Nice. You're not having just 1 or 2 glasses a week, but you're having 2 glasses every day. That simple math shows that you're having like 3 bottles a week. That is a lot, right, Doc?
That is actually above the recommended daily intake. So I mean, if you really wanted to drink wine, it'd be 1 glass a day, and that'd be healthy. But how many people really do that? So as long as you're not doing it every day, it doesn't really matter. And you take a couple of glasses here, a couple of glasses there, I think it's okay.
Thank you.
I think it's all right. And you know why I think it's okay? Most of all, stress is the biggest killer of them all. And if some people find that drinking a glass of wine, sitting with your friends and having a chat, de-stresses them, brings down stress levels, it makes it okay. And laughter is one of the best medicines of all. And if you're sitting and laughing with your friends over a glass of wine, that's fantastic. And the way the world is nowadays, most of these things are social, and it happens over a glass of wine or a drink or a beer, and that's all right. That's okay. So from that point of view, I think it's all right. But it doesn't. Drinking wine in large amounts does not reduce heart disease risk. I'm afraid it doesn't.
Right.
It's just people trying to justify their wine drinking. That's all.
Right. Thank you for that, Doc. Okay, we are engaging a great conversation with Dr. Dinesh Nair, cardiologist from Heart Matters Medical Center Private Limited. And we are talking about this topic on how to prevent and detect heart disease. So if you're watching this, we are live in Facebook, LinkedIn, YouTube, and eventually we will be in Spotify and Apple Podcasts within the next 2 hours of this podcast. So if you're watching this, press the share button, press the like button so that more people can engage into this conversation and listen from our Dr. Dinesh Nair. Doc, we are going to go into the next one, which is, of course, earlier we talked about it. Is there a certain age, like 30 years and all above, we have to go for medical checkup? Because I'm not sure if we had this conversation in the past 2 podcasts. Heart attack can happen to anyone at the age of 24. Is that right, Doc?
It can, yes. It can happen to a lot. I've seen a few 20-something-year-olds. I've seen teenagers with heart attacks. It's very rare because they have a congenital issue, familial hyperlipidemia, where the cholesterol is super high and no one knew until the first event. But you're right. It can happen at any age. And I mean, what you're asking is, how do you determine if someone's at risk, right? How do you know?
Yep.
So risk factors, there are many of them. Okay, high cholesterol. If you've got bad habits, smoking, not exercising, or if you've got bad genetics, what are your genetics? They're basically the culmination of several generations of practice manifesting into the current generation. So if you genetically have high cholesterol, if you have a lot of family members who've got heart disease, and unfortunately Indians have higher risk of heart disease compared to the Chinese in Singapore. Chinese have slightly higher risk of some other disease compared to the Indians in Singapore. It is a genetic predisposition as well. So if you have all these risk factors, high blood pressure, or you've got diabetes at a certain age, you're at a higher risk. Okay. And I often get this question, they say, okay, doc, tell me, what are the early signs or the earliest signs of heart disease? And when I get them, then I'm going to have a good lifestyle. That doesn't work because you're supposed to be trying to do this from the beginning to reduce your risk anyway, right? It's a very interesting fact. 50% of people with blocks in their heart arteries don't have symptoms, and they're big blocks. Small blocks, almost nobody gets symptoms, and small blocks eventually always become big blocks unless they are treated with medication and lifestyle changes as well. But the funny thing is 50% of people who get chest pain don't really have a heart attack. They're not having a heart attack. They may be having gastric issues. They may have a neck spine issue because all the nerves sit in one area, coming from your neck, coming from your muscles, coming from your gut, coming from your back, and all of them sit in one area for some reason. So chest pain does not mean you have heart disease, but not having chest pain does not mean that you don't have heart disease either. So what we need to do is detect the risk factors, look for little signs, check your bloods, know about your family history, make sure you're healthy to start with so you can reduce and mitigate those risks to a large degree. And that way you can figure this out. So how do you know if you're at risk? The funny thing is everyone is at risk for heart disease because eventually heart disease is a disease that increases with age. And we live in a very interesting time now because, you've heard this whole saying 40 is the new 30, right? 60 is the new 40, 80 is the new 60, 100 is the new 80. But by the time you reach 80 years of age, everybody has some blocks. It's just a question of when you get them, right? So everyone is at risk. It's just a matter of who is at higher risk of getting heart disease. And for that, we need to look at the risk factors. And, sometimes all you need to do is actually go and do a test and you'll know whether you're at risk. And those tests include blood tests, sometimes doing a treadmill stress test when you're above a certain age. A lot of us have gone to the army above the age of 40. Everybody's advised to go and do a treadmill stress test because they don't want the 40-year-olds going out there and running and having problems, right? But if you're above 50, your risk is higher. If you're above 60, your risk is higher. And the funny thing is, women tend to have a lower risk of having heart disease because they're protected by estrogen. Now, when women hit their menopause, there's a catch-up phase over the next 10 years where they catch up with men's risk of getting heart disease. So by the time they hit about 60, their risk is up there too. Their cholesterol starts to rise, the estrogen protective effect goes away, and women start getting that similar sort of risk as they age as well.
Right.
So everyone's at risk. It is just a matter of being smart enough to do certain tests to figure out if you are at a higher risk. And that in the first simplest test is a blood test. I always tell people if you're above the age of 40, 50 years of age, there's no harm. And if you can afford it, go and do a CT scan of your heart arteries. You'll know if you've got no plaque, a little bit of plaque, a lot of blocks, or not. And based on that, you can decide on what type of intervention you need. Very often it is just taking a tablet to reduce your cholesterol. And that reduces your risk by 50% straight away. And so your risk is here. You take the tablet, you go back down to below that of someone else who's not on the tablet.
Right.
These are all just little bits of information I thought we should share.
Perfect, Doc. Thank you so much. I got a question right now. Say good evening, Dr. Dinesh Nair. Wonderful explanation on the risk factors. If you could just shine some light, how does a person who smokes up to 80 years old lives without any issue, well, heart attacks happens at the young age of below 30. So I think this person just wanted to know how, someone smokes and, at the age of 80 is still living. I mean, of course, in a lighter side of it.
No, it is a very funny question, a very interesting question. And it's a question that many people do ask. They say, oh, my buddy, he's smoking away and he's drinking away, and nothing happened to him. Then this other buddy who exercises like mad ends up with a heart attack while playing football, right? How does that happen? It's because it depends on your individual risk. So this dude has been smoking away I'm saying dude, I'm assuming it's a guy, right? Okay. Who's been smoking away for many, many years, never had the other risk factors, never had the high cholesterol, never had the genetic predisposition, the family history, etc. Whereas you've got this other guy who doesn't smoke, exercises like mad. Everybody in his family has got cholesterol 3 times the level of what is normal. Once again, his risk goes up straight away. Now, if he, had been smoking and drinking and doing all those, I'm not saying there's anything wrong with drinking to excess, and not exercising, then his risk would have been higher at a much earlier age. So this guy, what he's done is he's been lucky. And a lot of heart disease, a lot of other diseases, a little bit of luck. It's what cards you've been dealt with in your life, right? So these fellas don't have all those other risk factors. So their heart disease manifests later in life. And this guy who's smoking at the age of 80 most likely has got blocks already. It's just a question of whether he's actually gone to check. And very often, many people don't. So there's a little bit of luck involved. It's your genetics to a large degree. That's what it is.
Right.
I hope this answers your viewer's question.
Sure. Thank you, doctor. Thank you for that. I'm going to go into the sign and symptoms. The universal sign that, someone, just whole year is choking, whole year means chest pain. Hopefully it's not love sick. That's why I talked about it earlier of the podcast. Really? Not a right to ask a cardiologist, but really the heart matters, right? So what are some signs that someone might have heart disease, doc? I mean, is there... we talk about risk factors, but now we're coming into the signs. So somebody's holding there. Is there a possible? There can be an angina. Is angina also a myocardial infarction, doc?
So the funny thing is, we referred to this earlier on, that people always ask, what are the first signs, the early signs? There are almost no early signs. Sometimes the first sign that you have heart disease is when you've had your first heart attack.
Yeah.
So these are late signs, because by the time you start having symptoms, the blocks are severe. The idea is to detect it early before those signs, before those symptoms occur as well. Now, if someone's having chest pain, those classical chest pain signs, the ones you see in the movies, right? When someone's having a heart attack, true enough, but only 50%, if you remember what I said, 50%
Yep.
of people get those typical symptoms and signs of chest pain. Now, how do you differentiate between angina and a heart attack? You mentioned angina, you mentioned a heart attack. Angina just means chest pain caused by lack of blood flow to the heart muscle. Now, if that angina chest pain is prolonged and you have complete occlusion, so your heart looks like this, okay? And there's arteries sitting on top of it, okay, like this, right-sided artery, left-sided divides into two for most people, okay? Left side divides into two and right. Now, if one of those arteries is blocked off partially, you tend to get angina. If that pain lasts more than 15 minutes, there's a very high chance that artery is closed off completely. And after about 15 minutes or so, it continues to 1 hour, etc. That person is usually having a heart attack, because the heart muscle can survive for a few minutes without blood flow to it. But after a while, if there's no blood flow, there's no oxygen, what you get is death of the heart muscle. Death of the heart muscle is what is called a heart attack. And that is irreversible. Now, if someone's had a heart attack and you call the ambulance and you're taken into a hospital, and someone like me, a cardiologist, so there are different types of cardiologists, those who do intervention, who do ballooning and stenting like myself, and there are others who don't, right? So let's say someone like me is called in, let's say to a government hospital or to our hospital where we're at Mount Novena. We go in, we open up that vessel, we supply blood back to that heart muscle. Some of it's already died. Now, the longer the lack of blood flow has been there, the higher the chance more of the muscles already died. If you get there earlier, as I said, in Singapore, we have provisions for the ambulance to come in very fast, and we protect that heart muscle. What you get is death of this part of the heart muscle, but the surrounding ones are still okay. They can compensate for it. So that's why sometimes people have big heart attacks and sometimes other people have small heart attacks, because it depends on how much of that heart muscle is supplied by the artery that's closed off, and whether it's partially or completely. Partial closing off can cause angina. When you exert, you don't get blood flow going through, so you get chest pain. But when you rest, it goes away. So that is angina. But a heart attack, no matter what, that chest pain usually continues if you're getting it. Now, once again, some people may not get chest pain. They may just be breathless. They may think it's gastritis. And if it's in a small artery, sometimes you can get a silent heart attack. That heart muscle dies off, and you never know that you actually had symptoms. Silent heart attacks, in some studies, have been found in 50% of people who've been checked for heart attacks.
On a softer side, not on a serious note, but on a softer side, love sick also causes pain, doc.
I'm sure it can. But this is a very interesting question that you asked. There is actually a syndrome.
Oh, is it, doc? I didn't know
Called
about
broken heart syndrome, where the heart actually goes through a heart attack because of severe emotional stress, causing closing off of that artery momentarily. It's called broken heart syndrome. You can actually look it up.
Okay.
It's called, and the disease that comes up is something called Takotsubo cardiomyopathy. Some Japanese guys invented the name for it anyway. So Takotsubo cardiomyopathy. Interesting enough. So actually, people can die from a heart attack, from being lovesick, of very bad chest pain from it.
Wow. Thank you, doc. I mean,
that's really something you never heard of.
Yeah, never heard about it. Really, let's love sick, and that causes into another issue. Oh my God, stress is another factor, because I know we have a question that is pertaining to stress, which I'm going to pull in. Thank you, doc. We are already at 38 minutes of our podcast. Sure. We have a few more question to engage Dr. Nair, Dr. Dinesh Nair as well. I mean, of course, your dad is the famous cardiologist as well. I mean, I've spoken to him a couple of times, and you are sad. Doc, I mean, we talk about this in the past podcast as well, but we want to try to bring it back again. Cardiovascular disease seems to be in the high range or highest growth in Singapore. Is there any stats as so far has changed as we are now in 2024?
So cardiovascular disease, unfortunately, is considered a disease of affluence. The richer the society, the richer the food, the less exercise, the less people are out in the fields working, the higher the chance of you having heart disease. And that's why affluent societies tend to have more heart disease. And that's why it's growing. There's another reason it's growing as well, because people are living longer.
Mm-hmm.
People are living longer, so therefore more people in the population are getting heart attacks as they live longer. So these are the stats that we find. So our population is also getting bigger, so you get more heart attacks being discovered. All these things tie together, and that's why we're seeing more and more of heart disease. Now, heart attacks, yes, silent heart attacks occur. In the old days, in our parents' time, 50 years ago, 60 years ago, people had heart attacks and didn't know about it. They never checked, so no one knew you had a heart attack anyway. So with the technology, we're detecting more. We're also detecting heart disease early and treating it early, but it goes into the stats as people having more heart disease as well, because you're detecting it early as well.
Yeah.
So therefore, we're not exactly comparing like for like or apple for apple when you compare it to the earlier years, 30, 40 years ago, when we didn't have the technology we have now. But what you can see is that less people die from heart attacks now because of the technology that we have. Less people don't make it to the hospital because of the system we have in place. Less people going into the hospital with a heart attack don't come out. Most people who have a heart attack and go in and have a procedure done. And we only started having this island-wide in the early 2000s, where we do angioplasty, ballooning, and stenting. Before that, we used to just give medication for it. Most people survive that heart attack and come out with most of the heart muscle intact. And these are the stats that we have. And year on year, the numbers look better and better because we have all these systems in place and because the technology has gotten better.
Right, doc. I mean, definitely, myocardial infarction, famously known as heart attack. It's a silent killer, right? It doesn't,
Yes,
boost
it
to
is that.
anyone. Just a thing about a year back or so, maybe if you allow me to share this, a person who healthy, very slim, watch his diet, go for his regular trainings, walks. You can hardly see him. Doesn't smoke, doesn't drink. I mean, it's what I know. Actually, passed on. That's a bit of while exercising. So, like I said, the medical screening is very important for people who are watching this. Get your medical screening yearly done. I mean, doc, what is there a medical screening for heart, like every 6 months, every year? Is there something like a protocol that we need to follow?
So it is difficult to prescribe a protocol because a lot of protocols are in place in most societies with a view to also keeping the cost of healthcare down. So if you follow normal protocols, just doing a blood test every year, that's the minimum you need to do probably, right? As soon as you cross 30 years of age, 40 years, definitely you need to do. You may miss a lot of the stuff. So if you are willing to be out of pocket a little bit more and go and do more regular checks, you can do a full health screen where you can check to see with an ultrasound of your neck artery, see if there's early cholesterol plaque, because it's like the pipes in your house. If you've got a problem with one pipe, chances are the other pipe's on the way to having a problem as well. And as that house ages beyond 30, 40, 50 years of age, you start having a lot of pipes having issues. The electrical system goes a bit out of whack as well, right? So with age, this happens. So if you want to do simple tests that you could do, an ultrasound of your neck artery, which is just an ultrasound probe here, can be done in any health screening center. They do a very minimal one compared to the one we do. We do a more detailed scan where we can look for plaques or blocks in the whole segment sitting here. That will tell you straight away you've got early heart disease, early cholesterol buildup. Then that would lead us to doing the next best test, which I think is very useful, especially if you're above 40 or 50 years of age. Get a CT scan, your heart arteries done. I mean, general screening in a government sector or anywhere else may not cover it, but it's a small price to pay. You get a CT scan when you're hitting 40, 50 years of age, you know where your heart arteries are like. A CT scan of the heart arteries involves injection of contrast into a vein, okay, up here, right? These are veins in there. You visualize, see what the blocks look like, see if you got blocks, see if you don't, okay? And based on that, treat and take medicines as necessary. So if you needed to do screening tests, this is something you can do. But, then people ask me, oh, how often should I do a CT scan of the heart arteries? There's no prescribed time. But let's say you had a clean CT scan. Your cholesterol's good, your lifestyle's good. Chances are you're not going to have anything happen to you in the next 5 years. But you don't know what's going to happen 5 years down the road. Now, if you go and do a CT scan, you find you've got 30, 40% blocks, you're extremely unhealthy, you've been smoking, all kinds of things are not in your favor, chances are you might want to do that a bit earlier and check again. Now, if your blocks are big enough to require a stent, ballooning or stenting and stuff like that, then that's a different thing. But the advantage of that, once again, is as well, you find out you're 70% blocked, you stent it, you balloon it, you open it up, you reset that artery to a 0% block. The other arteries may have 20, 30%. You're 70, 80, 90% blocked, and one artery then becomes 0%. And then you can do the same test at some point a few years down the road. But generally, it's quite difficult for an individual to decide himself what test to do when. I would usually advise everybody to seek the guidance of a doctor. It can be your GP, it can be a cardiologist like us, and they'll be able to advise you what is right for you, what is the right test spacing, what is the right test frequency. But if you wanted to have a general rule, I'd say at least do a blood test once a year and see a doctor and go through those results. I find that many people do health screenings, decide not to see the doctor, take it away, look at it themselves, look it up on the internet, and then decide what they want to do subsequently. And that usually is not very helpful.
Yeah, thanks for that, Doc, because our viewers definitely going to take this advice and do their medical checks as well, just like your car. If you want your car, to prevent, any major problems, get it checked out. All right, Doc, I just got this spontaneous question for you, because I did a podcast with one of the neurosurgeon, and I asked him what will be your second job, or what is the name you can call it apart from a doctor, and he said he's an electrician. But for yourself, what do you call, Doc? A plumber?
Yeah, plumber. I'm a plumber, but then again, I'm also an electrician, and a plumber, and a bricklayer. I do everything. Okay, but that's because we do all of cardiology. So all of cardiology is general cardiology, plus my subspecialty is interventional cardiology, which means I do angioplasty, stenting. If someone's got a block in the heart arteries, I open it up with ballooning and stenting. So that's the plumbing, right? But we also look at the other stuff as well. We look at the electrical system of the heart. If someone's got an electrical abnormality, we can treat it with medication. We can treat it with certain procedures where we zap the abnormal circuits. You've got a short circuit, you zap the short circuit and redirect it. So we all have our own subspecialty. So within cardiology, my subspecialty is that of a plumber, but I do the general stuff as well. Now, there are cardiologists who are electricians. They don't do the plumbing bit, but they go in, they put pacemakers, they do certain procedures to treat short circuits in the circuitry, the electrical system of the heart. So there's different types of cardiologists, interestingly enough. So mine, I would be a plumber, yes.
Okay. And now, of course, often your space or work is very tight. Can I say that? Is it, because we have not seen anything like organ, we only see our body. The heart shape that we see is an emoji kind of heart shape, but it's not. But how is that in tight spaces? How is that, Doc? I mean, just for our knowledge purposes, just out of curiosity, how do you work in tight spaces?
So there are different types of cardiologists. There are different types of cardiac doctors. There are cardiothoracic surgeons, the guys who cut, and do bypass surgery. Nowadays, with the technology we have, we can do most of this stuff through a minimally invasive approach. Okay, so we don't need to send so many patients for bypass surgery anymore. And we do work in a confined space. Oh, this is coffee as well. Coffee with Vance. There you go.
You read my mind, Doc.
Straight away, I saw it as I picked it up. No, so this is where the wrist is. There's a pulse here where you feel your pulse, the radial artery. Okay, I don't know if you can see it. Yeah, I'm trying to get in the screen. So we pass the catheter into the wrist, up, sitting into the heart area, inject contrast in. That catheter is 2 millimeters small. Once that is in there, we visualize it on an X-ray screen in a cath lab. So it's like playing a computer game. So I'm kind of standing here, okay? The patient's hand is around here. We pass it up. The patient's head is on this side. There's a screen up above me. So it's like playing a computer game. We're passing all these wires, these tubes and all that in. It's traversing the heart. We're visualizing it on an X-ray screen while things are happening on this side. So that's how we manage. And it is a 2 millimeter tube through which all the stuff goes through. The arteries are 2 or 3 millimeters. The stents are about this size when we put them in, and they're tiny enough. But it takes training and, of course, many years to learn how to do this. And not everybody can do it, of course. It
Amazing.
takes time and a lot of training.
Years and years, decades and decades of practices and constant learning. I think that's the only way to be, doing it right. Thank you, Doc, for that, for highlighting some light on that. Doc, of course, viewers who are watching this, thank you for the steady flow of almost 20 over people are watching. If you're watching this, please press the share button and send it out to your friends, and of course they can view it. And then few of the questions that we asked Dr. Dinesh Nair on the topic of how to prevent and detect heart diseases as well. We are at 50 minutes of the podcast so fast. It just seems like we're just having 5 minutes only, Doc. If you are watching this, if you have any final questions, please post it up, because I'm only got 2 more segments. Then after that, we're going to let Mr. Dinesh go off because he has a long day. I know that. Doc, we talk about stress. Someone can be just in the office, but if you look at their systolic and diastolic, it can be in stage 3, 180 over 100 or 150. That's because of stress. How it stress really affect the heart, and can it lead to myocardial infarction?
So I mentioned cholesterol plaque. Okay, so I'm using this, okay, building up on the inside. This is an artery, okay? And what happens is cholesterol plaque builds up and narrows that artery and sits inside here. So what you have is a big layer of yellow cholesterol buildup on the inside of the artery. Now, that ruptures and heals. It's like a volcano, okay? You've got the top of the volcano, you've got lava underneath, and that's your cholesterol, your lipid-rich pool. It is encased by a cap. This cap, when this presses up, pops, and the lava comes out, okay? But unlike, the countryside or the villages where all the stuff flows down the mountain, it's in an enclosed space like a pipe. So when that happens, clots come by and form on top of it and block it off, okay? So this is how blocks in the heart arteries occur. Now, how does this occur? If there's enough pressure from below, popping the top of that volcano, it spews forward. What does stress do? Stress can be emotional, mental, physical, overexertion. It pops that cap and you get multiple ruptures and healing. This happens anyway when there's small areas. But when you've got a lot of stress, it puts a lot of stress on the cap of that volcano and make it pop forward. And that's how stress can affect it. Emotional, mental. Remember the thing I told you about the broken heart syndrome? That is stress on the heart. I mean, this is quite rare, but it does happen. The same way you've heard of people, the car breaks down and they push the car, and while they're pushing the car, they get a heart attack. It's something that they're not accustomed to. So they stressed themselves physically, overexerted, and caused that plaque to rupture. So that's how stress affects it. Multiple episodes are the same, and your blocks grow a lot faster. Stress also puts a lot of stress or strain on the walls of the heart artery, which are elastic. And over time, what happens is they get less compliant. And if they're less compliant, chances of blocks forming on the inside are a lot higher. So that's why stress can increase the blockages occurring. Even if your cholesterol is not super high, it can increase the chances of that cholesterol plaque or buildup or blockage popping and causing a big heart attack in that area. And it can also change the musculature of the heart muscle as well on top of it. Repeated stress causing high blood pressure to be high for a prolonged period of time causes the heart muscle to thicken. It becomes less compliant, less able to cope with the rigors of daily life.
Thank you, Doctor. A comment by Ashwin Siva. Thank you, Ashwin Siva. Very helpful. Thank you, Dr. Dinesh, for all of us to know about heart disease and prevention care. Thank you, Vance, for sharing this with everyone. Thank you, Ashwin, for joining us as well. Doc, I know this wasn't prepared at all. Something that's going to be off guard for you. It's what we call the random rapid questions. Sure. What is your favorite food, Doc?
Okay. Truthfully, I like chicken.
Chicken, okay.
Any type.
What's your favorite time of day?
Favorite time of day when I finally get to sleep and to get some rest.
I know we talked about this, Doc. I mean, do you still go for calls like 4 a.m. and 5 a.m.?
Yeah, we get called in and we have to take phone calls at all times, and our phone needs to be on most of the time, except when I'm on a plane, thankfully. That's the only time when it's off. That's my favorite time of the day, when I get to sleep finally and get some rest.
Your favorite teacher?
Wow. I think the guy who made the biggest difference in my life was my cardiology guru, the guy I trained with in Germany, who taught me how to do intervention. His name's Eberhard Gruber. But tell you the truth, that's from a different aspect of life. My favorite teacher or teachers, both my parents. Yeah, definitely.
Hopefully they are watching, because probably they will give you a kiss. Okay, going on next, because it's going to be a rapid question. What dish do you
let's
cook
go.
best?
Okay, I don't cook, so that sorts it out. I eat
Okay.
whatever is given to me, thankfully.
Okay. What motivates you the most?
The chance to make a difference in other people's lives. That's why we push so hard. That's the main motivation.
What is your favorite part of your role?
Of your role. When I get to treat a patient and save their life, when they've got a blocked artery and they're about to have a massive heart attack and you manage to save their life, that's the best moment.
How do you feel, Doc, when you do that, right? I mean, when you see their loved ones and you're speaking, okay, you know, all these usual what doctors say, right? But how do you feel inside? I mean,
I feel like I've made a difference, and so my life is worth it. All those hours, all that slogging, all that lack of sleep, it's worth it. When you manage to make a difference in someone else's life, definitely.
So you feel recharged, you feel very fulfilled, you feel very blessed.
And you move on to the next thing that you need to do, so that's what motivates you as well at the same time.
Amazing, Doc.
Otherwise, no one wants to work 100-hour weeks.
And that's what get motivates, right? Motivates you to, move forward, right?
Yes, of course.
Why do you choose medicine, Dr. Dinesh? Why not lawyer?
So many reasons. We come from a medical family, so it became almost natural. Somehow I ended up doing medicine, and somehow I ended up doing cardiology. My dad's a cardiologist too. I think he had a big role to play in it, because I tried to veer away, try and become a lawyer, do other things along the way, but somehow he kind of nudged me back, So in some ways, that's why he's my favorite teacher, because he managed to do it without me knowing and veer me in the right direction.
Thank you, Dr. Dinesh. I mean, that was a rapid question. Usually I won't prepare them anything about it. You did very well. Doc, I mean, I know how your schedule is, all right? I know you never step out of your office unless you go into the loo. That's how your schedule is like, day in, day out. And obviously, you go back, you're going to stand by. I know, despite with that, I really feel very blessed to have you in my Kopi Revenge show, sharing this in social media, reaching out to people. That 1 hour really makes a difference, because you can actually decide to go back home and have that rest, but you decided to stay back and, educate and share your expertise and bring lights to this. I mean, I really appreciate. Thank you, Dr. Dinesh, for giving your time for us for this one precious hour.
Thank you for having me on your show, Vance, and thank you for being my friend. Most of all.
Thank you, Doc. Thank you, Doc. I'm not going to hold you anymore. Before we end the show, usually I ask the tip of the advice, tip of the iceberg, what you got to say. So anything that you want to tell our viewers who are watching, because eventually it's going to go into our Spotify and Apple podcast, where people can listen to them while they're driving. What is your advice, Doc? That most important, precious, valuable of your most give up advice?
So if I had to just make one statement, and I said it somewhere earlier in the midst of the talk, everything in moderation. That's what we got to do. That's a simple way to manage our life. No excesses, but don't underdo things as well. Everything in moderation. Life-wise, that's the easiest thing to adhere to. Maybe not so easy to do, but it's a good principle. So everything in moderation, and things should fall into place.
Thank you, Dr. Dinesh Nair, for joining us for the third time on the podcast with Kopi Revenge with myself. And thank you so much. We will stay connected, and probably there will be a fourth one. Definitely, I'm sure.
Looking forward to it. Looking forward to it.
With a different topic, and interesting for us, for the public to know on the newest update of what exactly about the cardio is all about. Thank you, Doctor. Sure. Thank you so much.
Thank you, Vance. Thanks, everybody. Thanks for watching. Thanks for tuning in. I hope you learned something from this. And take care. Good night, everyone.
Thank you, Doc. Thank you so much.
Bye.
All right. So that was an interesting podcast with Dr. Dinesh Nair. I mean, having a conversation with a doctor is already tough. Having a conversation with a cardiologist is even tougher because the love, we talked about the love, the heart, how important is this thing? All right. A lot of stuff in our body, we don't pay respect to it. We don't really care about it. When something happens, then only we take a lot of, care and prevention. But sometimes prevention is so much better, but sometimes we just don't want to hear the truth, right? But sometimes truth can actually prevent us from going into the danger zone, right? Something that we don't want to play with, which is the heart, because that guy is working 24/7 without a break, without a holiday. You don't want to mess up with the heart, because if he messes up with you, life is gone, right? So that guy, you don't want to play with the heart. So do your regular checkups, like what Dr. Dinesh Nair has mentioned, with his valuable information about simple stuff, but can be complicated as well. But we need to understand, right? It's not just anymore about how your physique looks like, or what I eat, or how much of I exercise. It's about inside. We need to understand from the in to the out. That is very, very important, all right? Thank you so much for the viewers who are watching this. I mean, I know there are more viewers out there right now. If you're watching this right now live, I know it will be as well in the social media, but just press on the share button, all right? You never know who may need this, just to get that, your blood profile checked, check with your doctors, check with Dr. Dinesh, just to make sure that you are safe and sound. Prevention is the key for a lot of issues to come by. All right. So this is your Vance. I mean, nothing new. Thanks for joining me in my podcast. As I mentioned, every week there's a different topic that's coming in, kicking in. And this week, I'm really grateful to Dr. Dinesh Nair, who spent his 1 hour of precious time. All right. He can just taken that to relax a bit or have his wine or relax and recover, but he didn't. He just wanted to come in and give his talk as well. This is from the Heart Matters Medical Center Private Limited. This is your host. Let me catch you back again in next week. Till then, adios amigos. Everybody stay healthy, keep fit, go and do your medical screening. Very, very important. Till then, adios amigos.